are 7 types of corona. 4 types are common to human beings. They cause flu-like symptoms, particularly in the pediatric population. Last 7 days, 10 days, and they're gone. You don't need to treat them with antibiotics or anything else. Okay? Cough, nasal congestion, runny nose, slight fever, and they're gone. Then there are 3 types of coronavirus that are inherent to animals. And every once in a while, something happens in nature, in biology, and they jump from animals to humans. In 2002, that's the first coronavirus that jumped species from animals to human, and it was bat. And that coronavirus was called SARS. Then come 2012, in the Kingdom of Saudi Arabia, the virus, corona, reappeared again. And this time it jumped from a camel to human. And then comes 2019, December, we have yet another pop of a cluster of coronavirus where it jumped from animal to human. The theory today is it came from bat. And there has been some studies, or one study, that looked at the DNA makeup of the coronavirus, the Covid-19. And they found that it shared approximately 90% of genetic similarities with SARS. We know that the virus is highly contagious and not only symptomatic patients or people can transmit the virus, even asymptomatic. So one may have the virus, okay, with no symptoms and can transmit the virus unknowingly. I think the Chinese did not recognize the impact of this virus until too little, too late. And we're not criticizing China per se, but the virus life is in days and hours, whereas a human government takes weeks and months to react. There is no treatment for coronavirus to date, okay? There are several antiviral medications that we use in severe cases. We're using a medication called Kaletra. This is a medication that we use for HIV. And there is, for example, Journal of American Medical Association reported 66% rate. The number of subjects were very small. We're also in the States, the first 2 cases that used a drug called remdesivir. It's provided on a compassionate basis. So there are certain drugs that we use. They're not 100%. They're not even 70 or 80%. But when you're back to the wall, that's what you have. I work with corona patients every day. I see the sick ones. I can tell you, I go home with my family. I have elderly people, elderly parents I live with. I take precaution, wash my hands, put gloves on, and I go and see the patient. There's nothing to be feared of. You maintain a healthy lifestyle, eat right, exercise. If you smoke, stop smoking. If you're diabetic, control your blood sugar. If you're hypertensive, control your blood pressure. I mean, just common sense stuff is what I would say. And I think trust the government. I mean, trust the government. They're doing their best, and I think they've went over and beyond. Under the circumstances, they've done a wonderful job. The face mask that you see everybody's wearing on the street is useless. It's not useless. It should not be worn. You should wear a face mask if you're sick, so you don't spread your illness to other people. You should wear a face mask if you're going to a hospital or to a polyclinic. I can understand that. But to wear a face mask, hayallah, in the street haphazardly is really not recommended. That's one. I think what's most important is hand washing. Hand hygiene is not because you worry about your hand getting infected, but we touch our face about 90 times in 1 hour, unknowingly, okay? So touching the face, you know, if you have to touch your face, and you do that all the time, you have to have a clean hand. No one knows what the life of the virus. I can tell you the consensus. The consensus, there will be a community spread, okay? That the consensus is we will have this virus part of our repertoire, like H1N1. Some theories or some epidemiologist has said, like any virus, it will have its life. Come summertime, it will die off, and then next fall, next winter, it will reappear again. Nobody knows. The best answer I can give you, no one knows really that, no one can forecast the future at this point in time. If you can compare numbers, there are more people in the world infected with influenza than with corona. That's a fact. If you look at mortality, okay, the mortality from influenza A or H1N1, it's about 0.5%. If you look at the mortality from coronavirus, depending on which age group, but in general, the average is between 2 to 3%. So yes, mortality with corona is higher, but in terms of the in terms of who is more affected, population-wise, influenza by far outpaced corona.